If we look here, what we can see is that these are the three cranial fossas: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. And there are some venous sinuses and the arterial supply that form the circle of Willis, which are shown on this model. So, if we discuss the venous sinuses first, what we can see is that between at the margin of the lesser wing of the sphenoid, here, this this sinus is the sphenoparietal sinus, which is present at the level of the lesser wing of the sphenoid. It moves posteriorly and it drains into the cavernous sinus. So this is the cavernous sinus. This cavernous sinus in turn drains and goes towards the transverse and the sigmoid sinus by two parts: the superior petrosal sinus and the inferior petrosal sinus. This bluish impression, which is not really as shown as a sinus, this is the inferior petrosal sinus, and this is the superior petrosal sinus. So this is the first sinus which we discussed, which is the sphenoparietal sinus, the cavernous sinus, the superior petrosal sinus, the inferior petrosal sinus. If we look at the posterior part, what we can see is from here, what we can see is that this is the occipital sinus, and above it, this part is the superior sagittal sinus, which is present in the near the vertex and is present in an anteroposterior direction. This is the superior sagittal sinus. The superior sagittal, the occipital, the inferior sagittal sinus all drain at this point, which is called the confluence of sinuses. From the confluence of sinuses, the two sinuses emerge, which are the transverse sinus. The main continuation is on the right side, the right transverse sinus, and the other one is the left transverse sinus. It moves on the posterior part, the occipital bone, and then at the level of the petrous part, where the occipital bone meets the petrous bone, it goes downwards, forming an S, and this is called the sigmoid sinus. And the sigmoid sinus drains into the internal jugular vein. After the sinuses, we can also see the blood supply, which is coming towards the brain. The brain has dual blood supply, which comes through the vertebral arteries and also the anteriorly the internal carotid. So when we see at the level of the brain stem, there is the anterior spinal artery, the vertebral artery, which is present here. This is the vertebral artery going downwards. This branch, which is visualized here going back, this is the posterior inferior cerebellar artery. So this one is the posterior inferior cerebellar artery, this is the vertebral artery, this is the anterior spinal artery. The two vertebral arteries from both sides, they combine to form this basilar artery. In the inferior part of the basilar artery, there are two important branches. These are the anterior inferior cerebellar artery and the labyrinthine artery. We can see that this labyrinthine artery is going towards the internal acoustic meatus with the facial and the vestibulocochlear nerve. So this is the anterior inferior cerebellar artery, and this is the labyrinthine artery. Moving upwards, this basilar artery gives off multiple pontine branches, which are not shown here. At the upper part, it gives off again two branches: the superior cerebellar artery and the posterior cerebral artery. This posterior cerebral artery is the branch which contributes to the formation of the circle of Willis here at the between or almost just at the level of the cavernous sinus. And it gives off the posterior communicating branch, which communicates with the branch of the internal carotid artery, and this internal carotid artery, which is not shown here, it gives off anterior and the middle cerebral arteries. So this is the internal carotid artery, this is the posterior communicating branch, and the posterior cerebral artery. So this is all about the branches that are shown in this model.